Senator Hassan, Senator Cassidy.
Hey, Mayor Mitchell and Representative Eccles, I want to enter into a conversation with you. Mayor Mitchell, you were on the community board. Did they ever show you financials?
Financials were passed out each month. I'm not an expert in healthcare finance, but they were passed out every month, and it did show that the hospital was profitable.
Now, was it profitable on a margin, or was it profitable like, oh my gosh, you got some operating capital here?
It was, I think, more marginal.
Okay. Now, I'm struck, and this may be for Mr. Eccles, but we're hearing that they never went on divert in Massachusetts, that they would accept a patient for transfer even if they didn't have a bed.
That's correct, yes.
But it took our health and hospitals to make them limit theirs. Now, I'm a physician. I know that's because you didn't have staffing. Mm-hmm. If you don't have staffing, but you're still taking patients, then you're putting the patient in danger. I'm just going to say that. Did they ever discuss why they would not limit their number of beds without the state making them do so? Because presumably staffing had become an issue, and that's why the state limited it.
When I first called LDH, which would have been probably late October, December, or November, telling them we need help, I was told it was a private industry, private business, free enterprise, and until certain types of complaints were made, that there really wasn't a lot that could be done. An extremely helpless situation, knowing that things were not great in the hospital. And it took, I think, a different type of complaint. I think a patient or maybe a physician made a complaint to LDH, and it took that to get LDH to send surveyors to Glenwood to assess the situation. And
the specific complaint was about staffing ratios regarding the paucity of equipment? Tell me.
I think it was more about the lack of supplies.
Lack of supplies. Mm-hmm. Now, Representative Eccles, one of the things I'm interested in is a lease arrangement between Medical Properties Trust and the hospital. And I think you've reviewed some legal proceedings which have taken that which would otherwise be proprietary and has now become public. What were there market rates being paid for the lease, or were there above market rates? Can you give us a sense? Because I'm trying to, where is the hole in the bottom of the bucket? They're making money even on the margin, and yet there's some hole where the money's dripping out.
I think it all starts at the top. So as I understand it, and was reported by the Department of Health, that the lease between Steward and Medical Property Trust was equivalent to $10 million a year. So a property like Glenwood, $10 million a year is an enormous amount of money.
But is that market rate, or is that above market rate?
It's above market rate.
And do you have any sense, is it marginally above, 10x above? You see what I'm saying?
I think it's at least 2x.
2x.
And that's on the high end. $5 million a year would be a high lease for that type of property with the deferred maintenance and other issues. Steward, which is, of course, responsible, when a REIT owns an asset, the lessor, whoever's leasing the building, would typically be in charge of making improvements to physical plant. They have to keep that for their SEC rules. So in this case, they should have been investing back in the hospital. There's tens of millions of dollars of deferred maintenance in that facility.
Let me stop you for a second, because in our investigation, it looks like MPT has, for Steward in general, has, through forbearance of loans or just cash, returned about $200 million to the system. Now, I'm trying to be impartial here. I'm trying to figure out what's actually going on. So you could argue that they were putting the money back in the system to try and float the boat. But Mayor Mitchell, was there any, could you see from the community board or Representative Eccles from your investigation that any of this money was put back into that deferred maintenance, et cetera?
No. You could walk in the medical mall or the hospital now, and there'll be buckets, especially with the rain that's come through the last couple of days. There'll be buckets in the hallway catching water because of the leaks. I was in the medical mall last week, and you had to walk around things like that to get to the facility where I needed to get a test.
And Steward executives required employees, PTs, doctors, nurses, to go around and clean up the hospital, physically clean up, sweep, mop, to try to prepare for this next round of liquidation, I guess, as they're bringing in suitors to try to take over this lease.
So let me stop you, because I just, seconds left.
No, you got time.
You know, I keep on hearing corporate. Am I gathering that local decision-making, you couldn't say, by the way, that we need another coil to embolize a bleeding adenoma in the liver. You had to go to corporate to get them to pay for that. So, Mayor Mitchell, again, you're on the Community Advisory Board. Is our impression correct that local decisions had to be made corporately?
Yes. And so many of the different departments got moved out of the hospital, so it was even harder to get a decision or to get a response or to get anything done.
And what was the means of communication? Was it a kind of formal discussion, listen, here's our to-do list and here's our needs list, or was it more ad hoc?
It was really more ad hoc. I mean, the Community Advisory Board, I mean, we were not in the day-to-day operations, obviously. We're not in those decisions. It was more of a, here's what's going on in the hospital type situation.
Well, I'm going to, the chairman has generously allowed me to go a little bit over, but before I end, I want to thank the nurses. I used to work in a hospital which was publicly run, and always at the end of the fiscal year, we didn't have money for things, but it was the committed staff that made it work. And I just, like, my heart's beating with yours on everything you've done. So thank you all. Thank you all.